Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I'm here with one of our great clients that you probably saw on another video because her daughter had a remarkable recovery. And I thought it would be good to interview patients, talk to you, because you just had a styloidectomy. So when folks come here, obviously we do a comprehensive assessment. And one of the things we're trying to figure out is not just is there instability, but are there other co-structural morbidities, meaning are there co-structural things? For instance, somebody could have a jaw problem that's related to compression of the structures in the front of the neck. They could also have a shoulder or a thoracic instability. That's one of the things that they are going to have to get resolved to have their symptoms resolved. Now, when you were first assessed, maybe just tell your story about how right away we found out that you had some styloids that I felt probably are going to be the main issue for you. And then you did go ahead and get styloidectomies, and it's only been 5 weeks. So right. Even as it relates to this interview, she wasn't like so keen on doing this interview because but I thought it would be
puffy, my face is paralyzed. Yeah, it's not a pretty look, but
yeah, but we appreciate you because you get to tell like what was the deciding factor to do a styloidectomy. You did 1, you did 2, and then after 5 weeks, what's better, maybe what's not better?
So one of the things that, like, for me, I wasn't as critically ill as my daughter. It was like little things, and I'm kind of a stoic, tough person. I just get up and I go. So I woke up every morning with just kind of like a headache that would ease as I got up and moved around. I'd get up and kind of groggily go about, and the headache would ease. So I had 2 headaches. Now that I'm looking back, I realize that now I'm like, oh, that was a CCI headache. Oh, that was the intracranial hypertension headache. I can pinpoint them better now. So, but I also had a lot of dentists thought I had TMJ because whenever I open and close my mouth, there's a clicking on the right side. So that clicking has cleared up because, as it turned out, they didn't realize this. You didn't have that CT imaging when I was here last year. So this side styloid was growing into the jaw. So that's what that clicking was. So whenever I opened and closed my mouth, it clicked because that styloid was right in the mandible there. So that's cleared up. I figured out, because it was when I came here and you did the vital signs and everything, it was like, we can't even measure your left jugular vein. It's so compressed. Can't even get a measurement on it. And the right one was fairly compressed as well. So after that, I realized, oh, intracranial hypertension is a problem, and I started sleeping on an incline, and I felt so much better in the mornings with that. But now I can sleep flat like a normal human being. My jaw isn't clicking. I'm too close to the surgery to have started exercising again. But another thing that I noticed that now I realize was related to the intracranial hypertension and that styloid compressing the jugular is anytime I tried to exercise too much, I would get this headache that felt like my brain was literally going to explode. I would just be like, man, I don't know what this is, but it feels like my brain is just going to explode. Well, now I realize, yes, it was, because the blood vessels were so full because the blood couldn't get out. So I haven't tried exercising too much yet because I'm supposed to be taking it easy. But I did go on a good solid 5-mile bike ride the other day, and the instability in my hips started bothering me before the exploding brain sensation did. So so I'm looking forward to, as I heal more, getting back into exercise.
The doctor did one side at a time, or they do both?
He did. So the surgeon I saw, Dr. Hackman, does them both at the same time. So there's the right, and he makes an incision here, an incision there. So I have 4 incisions total, and he just goes through and takes them both out.
How long did the operation take?
Well, typically both sides he's able to do the full thing in 2 hours, but because when they went in, and this one was so much more complicated, It took 4 hours.
Oh, okay.
Because there was nerve entrapment and all kinds of things going on with this side.
And then maybe just like look at the camera and people could see where it now blink. Like it's easier for you to blink on that side, not on that
like
side.
I have to focus to be like, okay,
Right.
this eye blink. So the facial paralysis, they stretch the nerves to get the styloids out. He takes them, the surgeon I saw takes them up to skull base. So when the nerves get stretched, it takes them a little while to go back. But they do nerve testing before they closed me back up, and everything's working. It's just this side was a little bit more traumatized, and it's taking this side a little bit longer. But so he told me probably another 3 weeks before this clears, and another few months, 3 months before the swelling all clears in my neck.
Yeah, so sometimes I'll get asked, because there are times where somebody has instability, they have elongated styloids, and we decide together, though you made this decision yourself, but I had said
you had said to me,
yeah, you probably,
you need to get this looked at.
So there are times where after the styloidectomy, somebody may need a little bit of prolotherapy or other things to resolve whatever symptoms are still there. But I just say, normally what we do when someone's had a styloidectomy, I do check the neck vitals again. So what we do is, like what we would do with you, is, we would just have you lay down and do different neck motions and just see how much the jugular vein did open from the styloidectomy. And it sounds like you're doing better.
Yeah.
Like, don't you feel like you're doing better? And
I do.
how about your brain function? How like you had that really bad brain fog, or kind of like you're focusing and stuff, brain energy, how's that doing?
Yeah, I think I need a little bit more. So I had an adjustment done with Dr. Hutchison because I have that rotation, and now I realize the rotation probably had a lot to do with that styloid. So it's better, but it was even better this morning when I woke up after having that C1 kind of like put back.
Okay.
I will need some more prolotherapy. One of the concerns going into styloidectomy with also having comorbid CCI was that I was going to become more unstable again. And I am a tiny bit more unstable. I can hear a little bit of crackling, which I'll have that fixed after we get the teenager fixed.
What I want to do is, I just want to explain. So somebody has a left styloid. So this model, see how they have the left styloid. This is a normal styloid. This is an elongated styloid. So the body will compensate for the narrowing here by rotating the atlas or rotating C2 this way. Like they'll rotate this way. So somebody could be going to the upper cervical chiropractor or continuously going to the chiropractor, and the chiropractor says, oh, your C1 or C2 is rotated to the right all the time. Like all the time. It's rotated to the right, but you don't realize the body's trying to give more room between the styloid and
that vein. Yeah.
Right, so that's kind of what you're talking about. And because it's been doing that for so long, that can start the instability process, so the C1 or C2 becomes unstable. Oh, see, I almost did a styloidectomy, see that?
Well, yeah, I see that.
Okay. But no, I'm glad that you're doing better, and we just look to help you get all the way
I'm grateful
back.
that you found it, and I knew what to do to get better.